While Florida and other Republican strongholds are working to eliminate vaccine mandates, other states are forming a public health alliance to provide credible information about vaccine safety. And with turmoil at the CDC and a desire to please a political base calling into question public health and safety, there are a lot of questions about risks in the future. Joining me in the morning show, Dr. Jeffrey Goldhagen, a professor and chief of pediatrics at the University of Florida. Good morning. Thanks for being here.
Good morning. Thank you.
So Florida Surgeon General Dr. Joseph Ladapo moved to eliminate vaccination mandates across the state, including in public schools. Other states are weighing the same. So while some are working diligently to combat misinformation and reinforce the need for vaccines to protect our children and public safety, is this stark divide, the two realities, going to cause confusion? And what impact is that confusion going to have?
Well, it already has. This is not an issue of medical science or epidemiology or pediatrics. This is a political issue at this point in time. It's already sowing great amounts of disinformation. Children will now not be immunized who otherwise might have been. And if I were a parent, I would be afraid and be thinking very seriously about sending my child to school, in particular children who have any sort of medical problems, chronic diseases, and so on.
So right now, nothing has changed because no law has been passed. And fact is, immunizations are a requirement in public schools. There's no way around it. But do you, as a pediatrician, worry that given an option, some parents will become apathetic and not get their kids vaccinated?
Well, first, there is a significant number of people who are not getting their children immunized. In the past, when it was difficult to not immunize your child, now it's really very simple. So we're now down below 90%, which is way below where we need to be as far as herd immunity is concerned. And parents will just continue to not get immunizations. But it's really important to remember 90% of parents are getting their kids immunized, and the 10% who are not are placing those children at very significant risk.
All right, look, I was a parent. I had 4 boys. You know, they come home from school, and, you know, kids come home from school sick all the time. So if you've got kids who are sick and they go to school and they're exposed to other kids who are sick, it raises risks. We saw in Texas, for instance, you know, all of a sudden, measles sees a resurgence because of a lack of immunization. Is there a worry now that if there is a big problem with people who aren't immunized that, you know, all of a sudden polio, mumps, rubella, things like that make a comeback because these kids aren't being immunized against those diseases?
100%. And several months ago, we were very concerned about polio because we had polio circulating in the Middle East, and there was concerns that it would come here. We had a case of polio several years ago. There was circulating polio virus in suburbs of New York. So yes, polio, mumps. We have a case of measles right now. We have a case of tetanus right now in Jacksonville. We're seeing congenital rubella across the state. This is not a theoretical issue. This is a real issue. Parents need to get mobilized to say, stop this nonsense.
Is the public aware of what's going on, or do they have their eyes closed?
Yes, I think the public is somewhat aware. What pediatricians need to do, starting at this point on, is make sure all parents are aware. Parents need to talk to their pediatricians as opposed to listening to this disinformation. The Surgeon General is placing millions of people in Florida at great risk. Children are going to get sick. Children are going to be hospitalized. Children are going to die. And that is a direct result of these absurd policies.
What you're saying is parents need to talk to people that they trust. All right, factor in what's happening on the national level. Doing what health experts say is rubber stamping unscientific, reckless directives and firing people because they don't buy into the Trump administration's health mandates. Lack of adequate funding. Factor this in. Programs here in Jacksonville like HealthLink, Jax, and Jax Care Connect. Are we opening a Pandora's box here?
The box is already open. We're just continuing to open it wider. We are not the great free state of Florida. We're the great contagious state of Florida at this point in time. And the outcome of this will be significant. And it's not just children. It's adults, it's the elderly, it's people who are coming here as tourists, and it's people who have chronic illnesses. So this is not just about children. People are going to get sick. People are going to die. because of these political positions and policies. And unfortunately, children are being used as political pawns in this partisan time.
Right, so it all goes back to believing people that you trust.
Right. And trust your pediatrician.
Dr. Goldhagen, thanks for being here. Alicia.